So I'm going to welcome those in our live stream again to the 2021 School of Public Health DRPH Commencement. We're recognizing two graduates, Samuel Clasp and Jill Walsh. I believe we would all agree that today more than ever, people really recognize the value and importance of public health. And that's for obvious reasons, but without adequate public health leadership and infrastructure, a pandemic can really bring whole societies into a state of paralysis. And we've really seen that over the past year. But we've also seen how effective public health leadership and a highly successful vaccine has allowed us to begin to make progress and make a difference in the trajectory of this pandemic. As we steadily work to make progress against the SARS-CoV-2 virus, we're also seeing renewed investment in public health to strengthen the workforce, to facilitate greater preparedness, to provide new opportunities for you, the graduates of 2021. Nearly a year ago, the murder of George Floyd sparked a national reckoning around racial injustice and systemic racism in our country. And in public health, all of you know that we really recognize that health is a human right, and the work of eliminating health inequities and promoting social justice is really essential to everything that we do and how we train our students. In your public health career, you're going to be faced with choices regarding which problems to tackle, which communities to serve and help, how hard to push for change. In public health, we believe a person's well-being should not be determined by their race or ethnicity, their gender, their sexual orientation, or how much money they have, or any other aspect of the individual. It shouldn't be the case that where you live determines the water or the cleanliness of your water or air, whether you have access to safe and healthful foods, uh, whether you and your family can access healthcare or affordable housing or transportation systems or quality education. These basic needs should be available to everyone. In your work, graduates, remember that you are the champions for those who have been placed on the margins of society, those who have lacked economic and political power, those who have been told implicitly and explicitly that they're less valuable. In public health, we fight against injustice. A wise and courageous man once said, "We're not simply to bandage the wounds of victims beneath the wheels of injustice. We are to drive a spoke into the wheel itself." You will have to fight for those who are vulnerable again and again in your careers, whether it's fighting for public policies and programs that promote health, like maternal and child health and access to health care and preventive medicine, or fighting against corporate practices that threaten health, such as those associated with tobacco, alcohol, unhealthy foods, and environmental degradation. These are fights worth fighting. I'm confident that you are prepared, Samuel and Jill, to step forward and to embrace these challenges that we face today and even those that still lie ahead. You can be the difference in communities, locally, nationally, and globally. You've been prepared and you're really needed now. And so I charge you to go forward with purpose, to really go forward with confidence and with commitment to the work of social justice. It is the work of public health. Jill, Samuel, you're here today. We're here to celebrate you and your achievement. So before we proceed any further with the program, I want to invite all our guests and our faculty to join me in applauding our two graduates for spring 2021. At this time, I'd like to invite Dr. Harry Hyman, Director for our DRPH program, to the podium to speak.
I'm going to put yours underneath so I don't repeat anything that you've said. Okay. Good afternoon. As director of the DRPH program, I'm especially honored and excited to be able to participate in today's commencement and celebration with our two program graduates. Our Doctor of Public Health program began in August 2018, not quite 3 years ago. So Jill and Sam, you are the first. A daunting accomplishment in normal times, a truly remarkable accomplishment in the face of working full-time and completing a program during a global pandemic. In fact, you're not only the first GSU School of Public Health DRPH graduates, but you may in fact be the only ones graduating literally on the back of a global pandemic. So this is historic for a number of reasons. You've shown tremendous grit, determination, and resilience. And together with your families, friends, and colleagues, we're really proud of your accomplishments. The School of Public Health's DRPH program's vision and goal is to prepare the next generation of public health leaders. But leadership is the conduit, the means, not the end. Being prepared as a public health leader positions you to make a difference. For us, that means working to tackle the many complex problems we face in a way that not only advances health, but advances health equity. The past year has not only reinforced the importance of this vision, but has highlighted many of the critical challenges facing public health and our society more broadly. I want to share a few thoughts about the COVID-19 pandemic and what I think are some of the important lessons for public health looking forward. COVID-19 was an unprecedented global pandemic, the likes of which we haven't seen for over 100 years. And it wasn't just a public health crisis. It was also a social and economic crisis. Despite predictions early in the pandemic that COVID would be a great equalizer, affecting all populations with equal force, those of us whose work focuses on health inequities understood that this pandemic, like other health threats, would disproportionately impact communities already experiencing health inequities due to social, economic, and environmental disadvantage. We understood that the same systems that created and perpetuate social and economic disadvantage, including structural and systemic racism, are the upstream drivers of differences in health opportunities that result in unfair, unjust, and unacceptable health inequities. So this now includes increased risk for both exposure and worse outcomes from COVID. So COVID-19 was not the only pandemic we were facing. We were also facing the pandemic of systemic racism, what my colleague, Dr. Arian Buwa, and my senator, Reverend Warnock, have referred to as COVID-1619, seen not only in the disproportionate impact of the coronavirus pandemic, but also in the continuing violence and deaths of Black and brown people at the hands of police. In the face of these pandemics, we saw a profound failure of political and public health leadership. And we saw unprecedented political interference in the execution of critical components of our public health response. To be clear, we also saw Herculean efforts by an incredibly capable and committed public health workforce, working in the trenches with inadequate resources, infrastructure, and support. But with notable exceptions, our leadership failed. At this point, the US has counted over 32.5 million cases, over 577,000 deaths from COVID-19. Much of this, including the disproportionate impact on low impact and Black and brown communities, could have been prevented. These outcomes were not inevitable. They are now an enduring record of what happens when systems and leadership fail to protect the public's health, especially those who are most vulnerable. So what are the lessons for public health? Leadership matters. Adaptive leadership. If we learned anything from COVID-19, it is that planning for the reemergence of a problem from the past is not enough to prepare us for a new problem in the future, like a new coronavirus. While there is much we can learn from the past, we need adaptive leaders, not only to respond to new problems that we haven't imagined, but to respond to the many complex health and social challenges that we face. Collaborative and humble leadership, as envisioned in Public Health 3.0, is critical to the cross-sector upstream approaches needed to improve health outcomes and advance health equity. It shouldn't take a global pandemic for our federal government to recognize the critical relationship between housing and health. That stable, safe, and affordable housing is critical to both health and life opportunities. And it shouldn't take a pandemic to justify economic policies that reduce child poverty. We need public health leaders as comfortable talking about public health priorities and imperatives related to housing and early childhood and family income as they are about infectious disease outbreaks and herd immunity. Health equity matters. Actually, health equity matters most. If we in public health cannot be champions for health equity, focused on ensuring the conditions for everyone to achieve their full health potential, then we are failing. If racial equity is not only on our agenda, but at the top of our agenda, then we are failing. If we as a School of Public Health are doing our jobs, health equity should be our North Star, and preparing leaders to be health equity champions should be our obsession. I'm confident that these are the kinds of public health leaders that are graduating today. Jill and Sam, I'm so proud of what you've both accomplished, but even more excited about what's ahead for both of you in your careers. You are both examples of the kind of leaders that we aspire to train. Jill, your work on preventing child maltreatment at Prevent Child Abuse Georgia was already focused upstream. But now you have a much broader and deeper toolkit, taking advantage of the opportunity to pilot a new prevention approach for high-risk families and the opportunity to do a deep dive in racial equity work and policy advocacy with the Georgia Budget and Policy Institute. These, together with your coursework and interactions with faculty and fellow students, have positioned you well for the work ahead. Sam, you were able to develop a strong policy and legal epidemiology skill set that you used to assess the current challenges with disease outbreaks in skilled nursing facilities. Now, through your new position at CDC, congratulations again, in the Office of the Associate Director for Policy and Strategy, you have the opportunity to apply that skill set to housing policy. What an exciting new chapter in your career. My former boss, friend, and colleague, former U.S. Surgeon General Dr. David Satcher, said that to achieve health equity, we need leaders who care enough, know enough, do enough, and are persistent enough until the job is done. Both of you are well prepared and well positioned to be that kind of leader and champion for health equity. Use the privilege and the power of your education to make a difference. Be bold, be courageous, take risk, and move forward in a career filled with meaning and a mission to make a difference. I'm now happy to turn things back to Dean Lynn.
Will the graduates please rise? By the virtue of the authority delegated to me by the President of Georgia State University and the authority vested in the President by the Board of Regents of the University System of Georgia, I hereby confer upon you and each of you the degree described in the official records of the commencement proceedings with all the rights, privileges, and responsibilities thereunto appertaining. You may now move your tassel to the left. Congratulations. It's on the left already. At this time, I'm going to invite Denise Gavea, Director of Academic Assistance, to the stage.
Thank you, Dean Nguyen. At this time, we will individually recognize our first Dr.P.H graduates. Graduates, when I call your name, please approach the stage with your hooder. Samuel John Peter Clasp. Jill Walsh. Congratulations to our first Dr.P.H graduates in the School of Public Health at Georgia State University. At this time, I will invite Dr. Lynn back up for closing remarks.
Let me just congratulate our two graduates. You now join 1,355 School of Public Health alumni, so welcome to that club. You also joined 265,000 Georgia State alumni, so welcome to the alumni community. The individuals that are here with you today, they've been really vital to your success, I imagine. And in some cases, maybe instilled in you ambition, tenacity, a desire to learn, commitment to serving others, and maybe even encourage you to push beyond challenges that you were facing. So I'm going to ask the graduates to please join me in thanking those here today who are sharing this accomplishment with you and who really allowed you to be here today. So let's recognize the family members of the graduates. And let's give our graduates one more round of applause, please. I really want to extend my heartfelt congratulations to you, Sam and Jill. You are the inaugural class of Dr.P.H students at Georgia State University. On behalf of the faculty and staff here in the School of Public Health, I really wish you the best in your future endeavors. Please keep in touch. Let us know where you are, what you're doing. I have a sense you won't be far from us. And so I look forward to hearing from you often. At this time, our ceremony is adjourned, and graduates, if you so choose, you're welcome to take turns on the stage for photographs. So again, congratulations to both.